question 9 is from Councillor Andrew Dawson.
Thank you, Mr. Chairman. It's addressed obviously to Councillor Lynn Riley. Could Councillor Riley please indicate her response to the recently published data indicating that although some progress has been made, our roads remain significantly worse than the English average with regard to road injuries and deaths? Can we anticipate the rate of road injuries and deaths not being described as significantly worse than the English average sometime in the future, assuming of course the data remains available and is calculated on a like basis? Or would this be an unreasonable expectation for this borough in the light of the nature of our road network? As members can see, I've quoted the data, and again it comes from the same source as the earlier question. Thank you, Mr. Chairman.
I presume Councillor Mike Jones again?
Yes, I am, and again, thank you for notice of the question. Cheshire West and Chester Council is responsible for more than 2,500 kilometres of roads and a population which is predominantly rural or semi-rural in character. Inevitably, therefore, with this data being based on all English local authority areas, we do not compare favourably with the average because we aren't an average council area. And what you'd need to do is actually compare the data with like councils, where I don't think our performance is anything like as bad as you suggest. Thank you, Chairman.
Councillor Dawson?
Just a very brief point. It's not me that's making the suggestion. Of course, the suggestion is coming in the national published data. But just making that observation, I don't want to ask a supplementary question on that point. Thank you.
Yeah, thank you. Well, no need to sit down again, Councillor Dawson, because question 10 is also in your hands.
Thank you very much. A very serious topic, this one. Having made inquiries regarding the education attainment of our looked after children, I understand that the attainment of our children who are educated outside our borough exceeds the attainment of those educated within the borough. Could Cllr Harada comment on this and give advice to the council as the corporate parent for our vulnerable children what we should do to ensure the best education for them? Again, I recognise that the arrangements put in place largely reflect that which was done by the former county council.
Thank you, Chairman. Thank you, Harada. Councillor Dawson, for advance notice of this question. In relation to outcomes for children in our care, wherever they are placed, we want the best possible outcomes for them. Dr. Stevens, the Director of Children and Young People Services, has met with the Children in Care Council to hear their views and will be acting on the pledge that they have asked us as a council to adopt. This includes ensuring that they get the best possible deal in terms of qualifications and learning. To help us achieve this, we have recently appointed a head teacher of the virtual school for children in our care. She will champion outcomes and has begun to put in place new approaches to learning, new support structures to ensure that the vulnerable groups have their work appropriately accredited, and she will challenge our schools and settings to help them make the best possible provision for children in our care. She has already attended the Corporate Parenting Board and is tackling underperformance and general education issues for children in care with great determination and vigour. Although the head teacher of the virtual school is leading this work, outcomes for children in our care remain a shared responsibility. Where we as members are school governors, for example, we should be asking routinely about outcomes, provision and support for our children in care and pressing for improvements, including in terms of access to things like out-of-school activities. Thank you, Chairman.
Thank you. Councillor Dawson.
Thank you, Mr. Chairman. Thank you, Councillor Harada, for that answer. I won't ask a supplementary question, but with your permission, Mr. Chairman, I'll move swiftly on to question 11.
Thank you, Councillor Dawson.
Thank you. As Councillor Harada will know from earlier correspondence I've had with him, I am very concerned that our looked after children are not receiving the appropriate level of psychological support from the Children and Adolescent Mental Health Services, known as CAMS, or from any other appropriate source. Can I just point out that CAMS is part of the NHS? I gather that around 30% of our looked after children were receiving psychological support services at the time of local government reorganisation from a multi-professional team, which in this authority was disbanded on reorganisation, and that for those children no alternative provision has been made. I further gather that CAMS are refusing to provide support services for these vulnerable children and are arguing that the resources to provide those services were within the Council on reorganisation. As the authority's sole elected representative on the fostering panel, I note with particular concern the number of times that reference is made at the panel to this shortfall in provision and the harmful effects it has had and is having on our vulnerable children. Could Cllr Harada comment on this and, if possible, provide the reassurance that we are ensuring the best provision of these much-needed services to our most vulnerable children and young adults?
Cllr Harada.
Thank you, Chairman, and thank you, Councillor Dawson, for advance notice of this question. In Cheshire County Council, there were a number of multi-agency professional teams, as Councillor Dawson states. However, they were only made up of social workers and education consultants. These teams did not hold cases, but did provide a pathway into higher level mental health services. A review of social care showed that these teams were dealing with work that was rightly the job of case-holding social workers. Some references to multi-professional teams occurred at the panel because we have yet described well enough to all our social work teams the new pathways in mental health services. This is in hand. CAMS and social work teams have joint meetings established to clarify their working together. Social workers are now holding cases that are well within their professional remit, but with which they are less familiar and therefore less confident. We are working with CAMS to skill up the social work teams, and the CAMS team are giving social workers advice on appropriate ways to handle such cases. A CAMS board has been established, and this will help us both to identify and put right any genuine gaps in the service. Thank you, Chairman.
Thank you. Councillor Dawson.
I have to confess I'm somewhat astonished by that particular answer. Am I to understand that the issue that you're saying is that it is the skill of our officers that has been the issue and not the provision of resource and support services from CAMS?
No, I'm not implying that our officers are less skilled, but we are coming into a situation which we, as a new authority, have using staff, some of whom we have inherited, have not been familiar with the situation. We are now, of course, recruiting new social workers as fast as we can who have that sort of training and professional expertise which will cover the areas which you have identified as in need of addressing. Thank you, Chairman.
Thank you, Councillor Harada.